Working between the city and the country gives you the best of both worlds. On a professional level, I find it stimulating. I enjoy the variety. I enjoy the teamwork. It's really important that our country patients have access to equally good medicine, and that doesn't happen if we don't do it.
One of the lovely things about the work down there is the range. It's rewarding, substantial, meaty ED work.
The inland hospitals are all really close to the major centre in the region of Bunbury. Collie Hospital, for example, is a 40-minute drive from Bunbury Hospital, as is Harvey Hospital. Our furthest hospital away down in Manjimup is an hour and a half from Bunbury. A really interesting mix of primary health care, acute care and aged care.
You're going to get neonates through to elderly patients. You're in a rural community, so you have the potential for rural trauma, for road trauma. You have to rely on your clinical skills, but those supporting centres, Bunbury and Busselton, they know that their role is to support that region, and so they're very accommodating. They understand the challenges of being in the smaller sites, and they support you in that work.
I'm a GP. I do emergency work as well, and you don't know what's going to come in, and it could be anything from somebody who's cut their finger to a car crash. I find it stimulating. If I'm sitting in my emergency department feeling that I've got a problem I can't solve, there's always someone high up the line I can call.
Every site has its own unique medical model, but they're all well supported through ETS. We have the access to the WACS Command Centre, we have an inpatient telehealth service as well. So you're never on your own, you're always somewhere that you can call out for help if you need to.
So ETS is a service that's available for anybody working across rural health in WA. It's manned by experienced nursing staff, emergency physicians, senior trainees, and some GPs experienced in this space. And they will come online. It can be linked up in any of the hospitals in WA, and on a big screen, and they will be able to see what's going on and help and support you. That safety net, as well as working, having the opportunity to work without all the bells and whistles around you, is a wonderful clinical experience.
There's opportunities for doctors to work in a range of ways, either directly with general practice, visiting our hospitals, cover potential gaps on weekends or long weekends, to come and work as a locum covering our emergency department. And we also might have opportunities for doctors in the future who might be interested in salaried positions.
You see everything, you do everything, so the workload is variable both in presentations and in the amount of patients you see.
If you're on call all the time, eventually you get tired. But if someone can come and cover a weekend, that way you're not having to cover a clinic, you just have to cover the hospital.
Want a bit of a taste of the country and perhaps to step outside their comfort zone, experience some rural medicine and help their rural colleagues, but do that in a supported way. Might be someone who's like me at the point where I've raised my kids, worked part-time, had a great career as a GP. I now want a bit more of an adventure, and I'm certainly not ready to retire, but this offers a step into another world of medicine, and as a locum you also earn good money, so it's it's a win-win situation, a win for the country, but for the rural areas, but a win for you as you reach a point where you might be thinking of slowing down and retiring.
It's mostly on call from home or from the house that's provided for you. So for example, in Nannup, there's this beautiful little house that's all set up right around the corner from the hospital in this gorgeous little country town. And so you can be there and have your weekend, and then they call you when they need you, and you go in and do what they need you to do. And the other times, you can hang out with your family in the house, or you can go for a walk or have coffee, or look at the local market, or whatever's going on. It can be quite a pleasant working weekend.
There's that essence of medicine where you get time with a patient, you get to look at them, and you get to actually stop and listen and make really good clinical decisions and therefore affect outcomes.
Everyone's willing to chip in and everyone's willing to problem solve, and so you get a much more holistic care of your patient.
You can actually use those skills that you've worked so hard to gain but and work fairly autonomously, but also in that team environment.
Nurses in the country have got vast experience, and not just clinical experience. They know their community. They understand the individual people, they understand the local work settings. You know, they know that if they get a call from this area, that's an area where, say, they're farmers or they're mill workers, and so they're already anticipating the scenario that's walking in the door. And the value that adds to your problem solving is, you know, invaluable.
There's a wonderful community often in those small towns. Working in a hospital, you make great connections with that community.
I enjoy my city work. I enjoy having all the gadgets and having the full professional team around me. Absolutely, I do. But I feel the country practice gives me a connection to community. It gives me a connection to my surroundings and to my patients, and that's really something that matters in that drive to be a doctor in the first place.
All our towns have a lot to offer, different things as well, whether it's hiking, walking, swimming, kayaking, mountain climbing, mountain bike riding, motorsports, art and culture. It's actually a lot to offer with the inland.
There is a reward and a depth to working in those sites that's worth making the effort to go down that